Hey, everybody, welcome back. We've got another great episode of Gloves Off, and so much so that I couldn't knock her out in rounds like one, two, or three. So we brought back a great friend of mine.
Amanda Hill.
Hey, Amanda, how are you?
I'm good. How are you, David?
I'm not too shabby. It turns out it's June, and apparently it's like Men's Health Month. That's what I'm told. So
Hmm.
we've got some man topics to talk about today because maybe men aren't the best patients in your chair. I'm guessing your practice not different than mine.
Yeah. Sometimes they might not be the best.
Yeah. I mean, and I think there's reasons for that. Probably most require a different kind of doctor than you and I, but and some further help. But I want to talk today like about the whole concept of co-diagnosis. We've talked about co-diagnosis for decades in dentistry, but like how do we apply this? What is that for you?
Well, so some people, when they hear co-diagnosis, they think of it's between me, the hygienist, and you, the dentist, right? That we're coming together. But there's somebody that we leave out of co-diagnosis, and that's the patient. Because, we're the experts in dentistry, but our patient is the expert in them.
Hmm.
And I think when we come from a lens of co-diagnosis with our patients, particularly with men, and the reason I say this is because the majority of us hygienists or assistants are women. And now we even have more than half of graduating dentists are women, right? And so we don't want to come across as a nag. I don't want to be their wife or their mother being like, oh, you haven't flossed in 6 months. I know it, right? You better floss, right? They're not going to listen. Tune out. I didn't hear a word you said, right? So how can we practice co-diagnosis with our patient? And so there's some tools that are easy to use, cheap, which you'll love, right, David? Cheap, easy, right? I'm not asking any dentist
What
to
is that, a
invest.
dentist thing or a man
Right.
thing?
It's a both thing.
Okay.
It's a both thing. I'm going to get you both. Wow, man, I could be like so stereotypical right now, can I? Oh, there's a lot of microaggressions that are going to happen here. All right. So, but some things that are really cheap with our patients are things like using disclosing solution. And I know that
Hmm.
we kicked that out in hygiene school because we got in trouble for disclosing solution, but sitting a patient down and disclosing the plaque on their teeth, especially if you use one that has more than one color, that shows plaque that's over 48 hours old or acidic plaque, because gone is the excuse, oh, I didn't brush after lunch, because they always say that. And you're like, well, dude, this plaque is 48 hours old. So this is where you're missing. But it helps patients own their condition. Other things like probing out loud, actually saying 2, 3, 4, 2, 2, 6. And and if you explain some of those numbers beforehand, then at the end, like, you just say, hey, just, keep your ear out. Ones, twos, and threes are good. Anything over 4, we might be concerned about. When you sit them up, be quiet and let your patient say something. And then, so David, you hear that 2, 4, 6. What are you going to say?
I love that, especially when you framed it in the beginning to say like, hey, things no, David, number bigger than three, not good.
Not good. Bad,
Not
David. Bad.
good, bad. Six is going to be like, whoa, wait a second. You told me one, twos, and threes are okay, but what's this sixth thing?
Yeah. And then the patient says something like, well, what do I need to do? What do I do about that? So no longer am I now saying brush and floss and, do all these things. They are now saying, tell me what to do. And the mind is far more open. So it's gone from nagging to now coming to a solution together, which I think is a great way to help people communicate and listen.
Really like that. And I agree because we do. We tune out the nagging, especially if we come into the practice thinking, I'm about to be nagged. How
Yeah.
shockingly awesome is it going to be when we just put it out there for our patients to actually physically see it or hear it and have the opportunity to ask us questions. So listen, I know we're dragging you back because we've got more to talk about, but we're trying to keep these short and sweet for all of you watching and listening. I hope those tips helped until the next Gloves Off, where you might see Amanda again. Sayonara.